Hi everyone, I'm Go Chi-eun.
Assalamualaikum warahmatullahi wabarakatuh to our doctor, and also hi everyone. So I'm Siti Nursalah binti Allah. Both of us will present about nuclear chemistry in medicine.
In our presentation, we will have introduction, concept, advantages, disadvantages, and how the nuclear chemistry apply in medicine. So, many of you will be wondered what is nuclear chemistry in medicine. Nuclear medicine is a medical specialty that uses radioactive tracer, which is radiopharmaceuticals, to assess bodily function and to diagnose and treat disease. And this especially designed camera allowed doctors to track the part of this radioactive tracer. So doctors use nuclear medicine to test to diagnose, to evaluate and treat various diseases. This included cancer, heart disease, gastrointestinal, endocrine or neurological disorder, single photon emission, computed tomography or SPECT, and position emission tomography or PET scan are the most two common imaging modalities in nuclear medicine.
Okay, for the concept of nuclear chemistry in medical field is nuclear chemistry has significant application in medicine, particularly in nuclear medicine. Radioactive isotopes are used for diagnosis imaging, like Go Chi-eun had mentioned, which is PET, SPCET scan, and targeted radionuclide therapy like treatment cancer.
The advantages of nuclear medicine is it provides information on how organs, tissue, and cells are working, because other common imaging procedures only show the structure. And it can be also used in targeted treatments to kill or damage harmful or cancerous cells, reduce the cells of tumor, or reduce pain. And it also makes it possible for doctors to pinpoint the cancer cells, which can help them determine the best treatment option. This in turn allows doctors to avoid exploratory surgeries for many patients, which can be both risky and painful. The biggest negative impact on nuclear imaging is on women who are either pregnant or breastfeeding. The reason for this is simple. The tracer used in this kind of imaging generates a small amount of radiation, and while the risk of complication due to radiation exposure is small, it is still present. Besides, allergic reaction during imaging tests can occur as well. This involves some combination of dizziness, headaches, and fluctuations in heart rhythms, along with a possible dip in blood pressure numbers. Another downside is the time it takes to interpret the imaginary. This can take days or even weeks, which can also make things problematic for critical care patients who require immediate attention. It also doesn't have guaranteed assurance. In spite of the document benefits and accuracy, nuclear medicine does not give 100% guarantee of cure. There is room for doubt, but medical science is full of predictions, possibilities, and failures too.
Okay, just now Go Chi-eun already mentioned about advantage and disadvantage of nuclear chemistry in medicine. But first of all, we need to know how the nuclear chemistry apply in medical field. So the first one that I will explain is about SPECT scans, which is stand for single photon emission computed tomography. So these scans are primarily used to diagnose and track the progression of heart disease such as blocked coronary and arteries. They are also radiotracer to detect disorder in bone, gallbladder disease, and initial bleeding. SPECT agents have recently become available for aiding in the diagnosing of Parkinson's disease in the brain, and distinguishes this malady from other anatomically, which is related movement disorders and dementias. So after this, I will add one video about SPECT scan for more information.
SPECT, single photon emission computed tomography. It's a nuclear medicine study that looks at blood flow and activity. It was actually developed in the 1980s. If you go on PubMed today, there are over 15,000 scientific abstracts about SPECT. Here at Amen Clinics, we've done over 200,000 scans. Our youngest patient is 9 months, our oldest is 105. But a lot of people want to know, what do the colors mean? What do the pictures mean? So SPECT basically tells us three things. Good activity in the brain, good blood flow, too little or too much. And then my job is to balance it. If it's too low, we want to raise it. If it's too high, we want to calm it down. And we look at it in several ways, but to help people understand, we look at the outside surface of the brain. So here we're looking underneath the brain, down from the top, one side to the other. In this view, the color doesn't matter. It's really the shape. We want it to be full, even, and symmetrical. And how do we know what's normal? Well, we've actually gathered a database of hundreds of, quote, healthy, normal people, and that's what we see. To see the inside in areas that are increased in activity, blue is average activity, red is the top 15%, white is the top 8%. So white is really the most active areas in the brain, which are typically in the cerebellum, because the cerebellum, 10% of the brain's volume, has half of the brain's neurons. And so everything else reasonably quiet, but the cerebellum and often the posterior cingulate structure.
So the second one that I will explain today is PET scan, which is positron emission tomography. So this scan is imaging test that is used to reveal the activity level of tissue in our body. It can be with or without CT scan. This imaging uses a tiny amount of radioactive tracer, which is then tagged to a molecule of interest. Cancer cells love to take up glucose, but so are normal cells like brain, heart, liver to some degree. Therefore, it is normal to see this organ light up and treasure is saturated in urine. You will also notice that kidney bladder will light up too. But do not be cautious. It only indicated normal activity of diseased organs. When other organs or part of other organs light up, it is important to note its intensity measured as SUV. And infected cells or inflamed cells can take up glucose too. In addition to cancer, like the higher of the SUV, higher the chance that it indicates the cancer as opposed to infection or inflammation. And last but not least, always consult with specialists to discuss the imaging and implication of the scan result. And I will end this presentation with last one video about PET scan from this one woman that experienced to take the PET scan. So, Assalamualaikum warahmatullahi wabarakatuh, and I hope you all can understand. Bye!